everyone, welcome to this Facebook Live. We'll hopefully answer a bunch of questions for you. I'm Kara Sundlin, and I'm here with Orthopedic Surgical Partners. They're dedicated to delivering superior orthopedic care right here in Connecticut. So we're going to get a little Q&A, hopefully answer a lot of questions for you. Joining me now is Dr. Brian Schmitberg. He specializes in anything to do with our hands and our wrists, our thumbs, all of that. So thank you for being here.
Thanks for having me again. I appreciate it.
Yeah. So, people can be nervous when they think about going to an orthopedic surgeon. Just the word surgeon, right? They're thinking, I'm going to have surgery. But so much of what we might be dealing with working on our keyboards all the time, or athletic injuries, or all these things we could have with our hands, we might not need surgery right away. Is that true?
Very true, yeah. I think a lot of the things that I see, often you can treat them without surgery, whether it's injuries that just need a splint for a couple weeks, or other things like carpal tunnel or trigger fingers. Sometimes you can use splints or injections. There's a lot of different options that we try to use before we go to surgery.
Yep.
As surgeons, obviously, we like to do surgery and we like to make people better with surgery, but sometimes it's not the answer, and that's okay.
So let's go through them a little bit. How do I know? People joke all the time, like, oh, it hurts and I must have carpal tunnel syndrome. But what exactly is it? How do we know if we have this and we need treatment?
Yeah, I think one of the misunderstandings I see with carpal tunnel a lot is, like, if I use the keyboard a lot, then I have carpal tunnel. And that's not necessarily the case. Carpal tunnel is more that you have compression of a nerve that's in the palm of your hand.
Okay.
And the most common early thing that I see from that is people say they wake up at night because some of their fingers are starting to go numb. Oh. And it gets them to wake up. They have to shake it out. Some people say they have to go over to the sink and put some hot water on it to get it to feel better. Oh. I see a lot of people that drive long distances, and they'll say when they're holding the steering wheel, all of a sudden the fingers start to go numb. That is more consistent with carpal tunnel.
Those are all symptoms of carpal tunnel. So you might not even have a job where you're on the keyboard all the time. It could be from other things.
Totally random sometimes.
Okay.
There are plenty of people you do see that are using the keyboard a lot, but I think all of us use the keyboard a lot. So.
Is there a typical age? Like, do you not worry about it in younger people? I know they're typing using their phones all the time. Or can young people have it too?
They can. It's more uncommon for that to happen. So like 20s, 30s, it's not as common.
We're good until a little later.
Yeah, 40 plus, for sure you can see it quite a bit.
Okay. And then what is thumb arthritis?
Thumb arthritis, specifically, it's kind of like right at the base of the thumb here.
Yeah.
And that is...
That fatty part right here?
It's like, it goes all the way around the base of the thumb here. And the thought is, the nice thing about being humans is that we have thumbs that we can oppose, that we can move in lots of directions.
Yep.
But because there's so much motion at that joint, that's one of the joints of the hand that breaks down the earliest.
Okay.
And so I see a lot of people, unfortunately it's more common with females, so I see a lot of older females that come in there like, my thumb really hurts right here, it hurts when I grab something, when I try to turn a doorknob, I have a hard time opening a jar.
Yes, my mother-in-law will tell me now I can't really open things, so that could be a thumb arthritis.
Totally, yep. And then sometimes they'll look and they'll say the thumb just looks different, and it looks like it's kind of poking out a little bit.
So what can we do for that?
A lot of things you can do. There's little splints that you can use to help with the pain. There are steroid injections that also can help with the pain. Sometimes you can use therapy to try to help with some of the strength around the joint.
Okay.
And then if it's really bothersome, if you've tried all the injections and splinting and things like that, there is a surgery that's good for getting that pain to go away. The recovery just takes a little while for that. It's usually about 2 or 3 months for the recovery.
But if you're just hopping on the feed, I'm speaking with Dr. Brian Schmitberg, and you are an orthopedic surgeon, but as we're saying, you just mentioned that you might have to do surgery, but so much of what you do is actually not surgery. So if you're afraid to go to the orthopedic surgeon because you're worried the only answer is surgery, we need to kind of let people know that, and that's something I've been learning from interviewing all of you guys, is a lot of what you do has nothing to do with surgery, and people might see you for a long time and get better and never have surgery.
That's always the goal. We don't try to push surgery right away. And so if people can get better with the conservative management, then that's best case scenario.
Okay, so now we know thumb arthritis. So is it fair to say if you're getting a little older and you feel like you can't open things, you shouldn't tolerate that? You should go to a doctor?
I think it never hurts to go and see somebody and get an x-ray and kind of get an idea of what's going on, because there are things that you can have done that can help so that you're not struggling open jars, struggling trying to hold a doorknob, thing like that.
Yeah. And what about tendonitis or trigger fingers? I learned something new as we were prepping for this. I didn't even know exactly what, I've heard of trigger finger, but I didn't know what it was. So can you tell us a little bit what it is and what we should be doing about it?
Yeah, tendinitises in general, there's a bunch that we see in hand surgery and orthopedics as well. Trigger fingers, they're kind of a tendinitis. There are a couple thoughts of why exactly they happen, but the main thing that people will come in is they say they have pain in the palm of their hands.
Okay.
Sometimes they get swelling throughout the fingers. And then it's called a trigger finger because when it gets really significant, they could be moving their fingers around, then all of a sudden one finger gets stuck. And
Okay.
it looks like you're kind of pulling a trigger.
It stays that
And
way.
then some people have to actually manually flick it open
Okay.
to get it back working again. These are obviously very bothersome and concerning when you have a finger that's getting stuck.
Yeah.
But there's something that can be treated most of the time very successfully just with a steroid injection in the office.
And then you're back to normal.
A lot of times back to normal. The one caveat to that is patients that are diabetic, sometimes they don't respond as well to the injection.
Okay.
So on occasion we do have to do a little procedure, but I always try the injection first, and a lot of times it works great.
Okay. And then you also obviously, anything that pops, snaps, breaks. I mean, I'm thinking as a mom, when we get that horrible thing on the field and you're like, oh, so, your son got injured or your daughter got injured, fractures, hands, it could be lacrosse, it could be, whatever. Right now it's a football season, we're just wrapping that up. You do all of that as well. What's your advice for those parents on the side of the field?
I think if you have any concern and you have a son or a friend or a family member that has an injury and you're just not sure what's going on, just go and have somebody take a look at it, have an x-ray taken done to make sure there's nothing going on, or if there is something going on, that it's being treated appropriately.
Yeah.
I think the hardest thing for me is people that have an injury, a month ago, 6 weeks ago, and then they come in, it's still bothersome. And if it was a broken bone, it's just hard to treat when it's that far out.
Okay, so that's why you want to get it checked out. Same thing with, we learn a lot about concussions or anything like that, but just get an opinion quickly so that you don't end up having it heal by itself, because sometimes you hear these awful stories that it didn't heal right, or it has, I don't know if they do that anymore, they have to break it again, or I don't know.
Sometimes you do that, you don't want to do that, but sometimes that happens. I think it also just gives peace of mind, right? If you come in and your son's hurt and you get an x-ray and we say everything looks good, then at least you know it looks good on an x-ray, and somebody who's seen a lot of these can tell you that it's nothing to worry too much about.
Yeah, and also orthopedic surgical partners. So you've got several offices all across the state that makes it convenient. But a lot of times I think, especially if it's something that happens at home or it's with our kids, we just automatically think like, oh, go to the ER and wait for a really long time. But when it's something orthopedic, like that pop, that break, that's not, we don't have to go to the ER first, right? We can go straight to one of your walk-ins.
Yeah, we're like a orthopedic urgent care, and so any injury that you have, you'll be seen by either one of the doctors or one of the PAs. That all we do is orthopedics. And
So it saves you a step, and you're going straight to experts. You don't have to, people think, oh, I'm not going to get an appointment, or it takes a long time. You have urgent care. So as soon as you hurt yourself on the golf course or on the field or at home, we can go straight to your urgent cares.
Yeah, efficient x-rays, you're usually seen pretty efficiently, and like you said, it just saves the hassle of waiting in the emergency department for a really long time.
Okay. So anything that you want folks to know as we're getting into, I guess you see those kinds of injuries as we get into, we're leaving fall now, heading into winter. I don't know if it's raking, snow blowing, but things, from your side of the couch, of like any warnings you want us all to be careful about?
Yes, I think the things that I see a lot, black ice, right? So we're all looking out for that, but just be careful of the black ice. Unfortunately, we see a lot of people that slip and fall and break your wrist. So just be aware as it's getting colder that it could be out there. And then also when it's snowing with snow blowers, never ever put your hand in the snow blower, even if it's turned off. If you loosen up some of the snow, the kinetic energy in the snowblower can cause it to kick back in. And so unfortunately we've seen a lot of finger injuries from trying to fix snowblowers.
Yeah.
So please just be careful with those.
Okay, all right, so definitely do that. And I just want to share a little history. I know you're local, which is so nice that we have this great care, orthopedic care right here in Connecticut, but you were actually really inspired because in your own family, you watched your sister go through some medical procedures and she was dealing with a lot of pain, and that's what inspired you to become a doctor, I hear.
Yeah, I was much younger. My sister, she was diagnosed with skin cancer when she was young as well. She was a teenager. And so that was kind of my first exposure to seeing doctors. She's doing great now. She had great care when she was younger, but my family had a lot of respect for the doctors that took care of her. And I think it kind of pushed me in the direction towards medicine, and then I kind of found my own niche within medicine once I was there.
Yeah, why do you like the hands and wrists so much?
I don't know, I wasn't expecting that when I went into orthopedic surgery. I thought I was going to be a joint replacement surgeon or do some sports surgery, but I think a lot of the stuff I saw in hand surgery was really satisfying. People do really well from carpal tunnel releases and trigger fingers and kind of the stuff we see all the time.
Yeah.
There's also a lot of variety, which I really like.
Okay, settle this. I don't know if I'll tell the answer to my kids, but you know, we're always told the cracking your knuckles and all that is not good. But then they say that, you know, doctors say it doesn't really give you arthritis. But what's the rule on cracking?
I think it's fair game. I've never heard of anything bad about cracking your knuckles.
So I can't tell my kids that.
You can, but...
You can, but it's just not true. Cracking doesn't really cause any kind of problem, really?
Not that I've seen, no. Maybe someone smarter than me can say that, but I haven't seen any data.
No,
on
that's
it.
usually what the doctors say. It's just, it's not what we heard when we were little, so yeah.
That's true.
All right, so thank you for, Dr. Brian Schmitberg is at Orthopedic Surgical Partners, and I want to let folks know where they are. You can go to the website, ospct.com. You can call, and again, you can get treated same day doing walk-ins, 860-525-4469. Can you shout out where the offices are? I know one of them's right across from here in Rocky Hill.
Yeah, the one in Rocky Hill is at 1111 Cromwell Ave.
Yep.
So it's about a couple minutes away from here. Then we have one in Avon, which is 31 Inside Drive in Avon.
Yep.
And then also in Manchester off of Middle Turnpike.
Okay, so even if something happens on the weekends, we can go to you.
Sundays we are closed,
Okay.
but Saturdays all day, the one in Manchester.
All right, and so just keep that in mind. If it's a hand, you want to go to Dr. Schmitberg, but if you pull out your back and all this and you're thinking, I have nowhere to go, the fact is, you do. You can get seen.
Absolutely. We'll try to see you same day. We try to be efficient.
Okay. Doctor, thank you so much for being with us.
Oh, thank you.
All right, and thanks for being here. Hope you learned something.